To move through the airway and breathing course here, sometimes bizarre situations come up where you have restricted access. Maybe your patient needs spinal motion restriction to be maintained. That makes it difficult to manage their airway because you can't move their head and neck like you normally would. And or sometimes they're entrapped in some sort of amazing rescue scenario where you really only have access face to face to them as opposed to being positioned at their head like you normally would. So we'll talk face to face. This real quick. This is one of those tools for your toolbox that you pretty much bury in the bottom of the box, and in case you need it someday. But these guys would not have a gag reflex, and they're in entrapment situations where you really can't get to them from the head as usual, but only from the front. And this is weird. I think it's weird because now my right hand is holding the laryngoscope, and that's not right. The left hand's supposed to hold the scope, but in face-to-face, you do switch around and use your right hand to hold the laryngoscope. And so you're facing the patient with the scope in your right hand upside down. The non-politically correct slang for this is tomahawk, if that helps describe anything to you. You insert the blade as normal, it's just you're facing the patient and the scope's in your right hand. Gentle forces, pull the jaw towards you. Good practice in the lab will help you get more comfortable with this. Use your usual assistance. You still want somebody with thyroid pressure. You still want to make sure you've placed and confirmed and secured just like normal. It's a strange technique that we'll practice in the lab. We're actually working on this coming week an improvement in our extrication prop to where we have a vehicle that we can get you set up to do some airway management stuff. And this will be one of those sorts of things. Here's a picture of what it sort of looks like, but I'm kind of wondering if we have this kind of access, why are we not doing something otherwise? But this is kind of what you see in pictures. It's amazingly hard to get any good video or good images of face-to-face. So we'll practice this stuff in the lab, and I think you'll be more comfortable then.